Howdy, everybody. Welcome to Liberty Libations number 119. My name is Jake Green, joined as usual by Zane, Placie, Stephen Hilton, and Alden Hardee. And our guest for today is Dr. Jessica Edwards. Cheers, everybody.
Cheers. Yeah, cheers.
Love it. Jessica, can you tell folks out there who you are and what you do?
Yeah, so I am a family medicine physician. I own a telehealth practice. I'm licensed in 26 states. So I am kind of the cool doctor everybody sees when they want to talk about whatever they need to without judgment. And we actually sort of have an innovative model where we provide at-home physical kits for our patients free of charge. Yes, I did go to China myself and get those prices negotiated because they were cheap. And so we give all of our patients the kit free of charge because insurance does not cover preventive at-home physical kits. They only cover it once you have health conditions. And so trying to do healthcare in a different way and make it easy and accessible for young people, because nobody really thought about us with the fact that you have to get on the phone and call people when you want to do things. So like at my practice, you can text us if you have a question. We get back to you within an hour. We also have like an AI answering service. And then we also utilize a lot of technology and scheduling workflows to make sure patients can always get in with us. So I'm licensed from California all the way to like Ohio, Pennsylvania, Michigan, a lot of the deep southern states, Florida. I probably won't be able to remember all the states, but they're on my website at www.zaramedical.com. But we do also have a very affordable cash pricing for patients who don't have insurance. So if anybody's listening tonight and needs a doctor, we only charge, and you mentioned that you saw me on the show, it'll only be $99 for your visit.
There we go. All right. Well, what are you drinking tonight?
I'm drinking rum punch.
Rum punch. Nice. Oh, heck yeah.
I've got to say, by far and away the best drink from a guest we've had on the show in a long time.
That is very true.
It looked the best, yeah.
It looked the best too.
You put some garnish in there and it looked even better. I didn't have time.
Zane, what are you drinking?
I've got some gin and Sprite here.
Okay, gin and Sprite.
Gin and Sprite. Does that taste like college?
Actually, somewhat local. 3 Taverns, Night on Ponce IPA.
Yeah, I mean, I like the Ponce.
Yeah.
I don't care so much for the IPA again. Alden, what are you drinking?
The famous combination of a Japanese beer and a cheap tequila as a sidecar.
That's famous. Everybody drinks like that.
Everyone knows that.
I've got Guinness in a Liberty Libations glass, and then my sidecar, Alden, is Ardbeg.
Oh, that's way better than mine.
A little bit better than yours. I like the Irish Scottish combo rather than the
Micmac.
What is it? Mexican Japanese.
Yeah.
All right, everybody. Well, we're just going to dive right in. Jessica, you reached out to us on Podmatch, which is one of our services we use to try to book interesting guests that we would not normally have come across. How long have you been using Podmatch?
I just started like a month ago. I've done like 8 interviews already.
Dang, you're a go-getter. Holy crap.
I just graduated with my MBA last Friday.
Oh, dang.
Congratulations.
Wow, congrats.
If I do school one more time, he was like, listen, I've been with you through about 3 degrees, 3 fellowships, 1 more degree. And I said, yes, sir, I understand.
Yeah,
that's totally fair. Yeah, so what was the original inspiration behind creating your own company and founding your own company? Because that I know from experience that is a long and hard process. So how did that all start?
Well, it started, I grew up watching my dad provide amazing care to the people of Oak Cliff in like the South Dallas area, right there off Marsalis and 67. He still practices over there today. He has an urgent care. And I really just love that his patients loved him. Like, I mean, he would, and so I was actually a PK. So I kind of like grew up under, the scrutiny of, being, in a church, and everybody's like, oh, the preacher's kid did this and that. And so he was also a doctor. So he named our church St. Luke's. And so he would preach on Sunday, come home, eat dinner, and then go to the clinic. And he would always come back with goodies. And so during, it's back in like the early 90s. And so that's when medicine was still kind of between the doctor and the patient. And so I really, at the time I was like, Dad, I don't want to work this hard. So I don't think I want to be a doctor. And I thought about being a lawyer because, I like to argue. And so my dad was like, well, you might want to look into how many lawyers there actually are before you try to get in, to the field. And so I looked into that, really started liking sort of like lifestyle things. So I love documentaries. I love food. I love wine. I love, just different sort of cool things that you can do. So I initially wanted to be the Black version of Samantha Brown from the Travel Channel. And then by happenstance, when I was in high school, I got an extra credit point for attending Health Occupation Students of America, like their little after school program. I just wanted an A. That's the only reason I went. Next, I was president, I was pre-med, and, so it just, it kind of went from there because I really like helping my patients solve their problems. And so, I went through medical school residency. I trained in Jersey City. So, they say if you can make it up in that area, you can make it anywhere, and moved back to Texas for a little bit of time. And then it got a little bit sticky with some of the legislation around delivering babies. I was kind of like Dr. Quinn, medicine woman. Like I would be in clinic and then they're like, your patient's crowning. You're like, okay, I'm running to the hospital, And so, once I kind of started to see the business side of medicine, when I finished, I was like, man, this is a mess. And so you have all of these administrative people telling doctors how to administer care, how many patients they have to see, what their productivity actually looks like when they've never seen a patient a day in their life. And so I took on a chief medical officer role in New York City about 2 years ago. And that whole experience of like having to mind someone else's business almost took me to my knees. And I was just like, there has to be a better way. This really sucks. And I'm like, do you want to come see patients with us? Because if you can come see patients with us, you'd understand. They're like, oh no, I don't need to do that.
Yeah.
So that's when I was like, I'm going to get my MBA and I'm going to be the suit, but in a skirt and the stethoscope, and understand actually how to be profitable without exploiting people, and also making sure that patients have a great experience. So my husband, he has his MBA, his business degree from Rutgers. I was getting my MBA. And so that startup ended up closing. And so I was like, you know what? It's now or never. So I just tried to create the practice that I would want to go to and have the accessibility that I would want to have if I was a patient. And it just kind of took off from there. And I got licensed in multiple states, and I take care of patients all over. And I really love what I do because I'm a happy doctor. I don't have to see a ton of patients in order to cover my overhead. We utilize technology to make things easier. And I get to be and involve my mom and wife as well.
I love that. I'm not the only one. I've hated going to the doctor for my entire life. And then 6 months ago, well, actually a year ago, I interviewed a guy on a podcast for the Libertarian Party who was like a naturopathic, homeopathic kind of guy, and started going to him. And it's a delight. Like it's an hour and a half, and there's no waiting room. You just walk in and you talk to him.
Yep.
And it's such a better, I almost look forward to going to the doctor now. It's like a completely different experience.
Correct.
Oh, absolutely. I started seeing an osteopath, and same thing.
I'm an osteopath too. Yep. Second generation.
So, I walk right in, we sit down, and it's basically like Sunday school. Like I'm just hanging out with this guy. We're talking about, being fathers and business and just all kind of stuff. And, he'll hook me up to a little machine and we'll just be talking. And he's like, kind of stressed out, aren't you? I'm like, yeah.
Yeah, you just said it. You just named business owner and father.
So I really like that approach of, instead of just trying to prescribe away the symptoms, of actually trying to get to the root cause and find through nutrition, a way to actually cure remedy the actual problem.
Correct.
Yeah. One of our audience members asked, do you have any staff?
I do. I have a couple of staff. We're pretty lean. I have a virtual receptionist. My mommy actually works for me, helping out with some of our marketing and outreach. And I have a virtual MA who helps to triage room my patients. But we found a way to make this work with insurance, which is usually not a thing. Mm-hmm. Usually, if you have insurance, you're going in, they're like, all right, so you're here for okay, perfect. So we'll see you back in 3 months. And it's just in and out, in and out, in and out. And so with this model with with being virtual, I actually get to spend more time with my patients than if I was in office, because you don't have all of the distractions. You don't have people, oh, hi, Mr. Brown, we see you're here for chlamydia today. Come on back. Is it burning?
Yeah.
I mean, I literally have like sat in doctors' offices and like heard people like, okay, so your social number, okay, I'm just gonna read it back to you. And you're like,
Oh my God.
Yeah.
no, and so it just, I don't know, I feel like the virtual care kind of helps to remove that barrier of fear when people have to physically like get themselves together, go in. I have a lot of like working moms who will see me late in the evening because that's when my kids are asleep too. And so, the moms are like, hey, my kids finally went to bed. Now we can talk. I can work on myself. And it's great. My plan is though to open up in-person locations utilizing an RN in digital medical technology so that the doctor can take care of multiple places at one time and allow patients to walk in. But, we've got to get funding for that. But, we're starting off and we're crawling before we walk, but it's been an amazing experience really getting to know my patients.
That's amazing. That's amazing. Alden has a lot of know-how.
Medical problems.
Yeah. Medical problems. No, his girlfriend works in the medical field, so I'm sure he has a lot.
He's also works from home and has spoken to the people the type of person that are more comfortable, and that it opens the door for people to seek the help, without having to sometimes, like, if you're like agoraphobic and like you want to help for it, like the irony is that you're like, oh, what do you got to go out in the world to seek the help for it? Like, this is just a silly example, but it does open the door for just that many more types of people to seek help. So
yeah, and if you're super remote, like you're moving up to the middle of nowhere, Montana, like we're gonna be super remote, and doing anything telemedicine would be far preferable.
So when you fall down the mountain and break your leg, like you can just hop on a call and be like, does this look like gangrene to you? Yeah,
exactly. That's exactly what's going to happen, Alden. Thank you for that.
Yeah. Does this look infected?
Oh man. Lord have mercy. So yeah, on this show, we tend to tackle a lot of things from a liberty principled direction. And one of the things in your message was talking about how government regulation and corporate influences hurt doctors and patients. Yes. And so can you go into a few of those ways that you've seen that happen?
Yeah, so I guess starting from the top, like with Medicare and Medicaid, I think Medicare was, created to provide care to our elderly, and the system is just really flawed. I mean, if you look at how many different contractors there are for Medicare, it's not like you can just get a single Medicare credentialing and take care of people in any state. You have to get credentialed in each state that you practice in, which means you have to have an address in each state that you practice in. And so it's same thing with Medicaid. And so every state does it a little bit differently. And so I think that harms patients, because if you were to move, you kind of have to start all over. And so I also think that, the amount of money that's paid into these programs is not quite being used as it should be. There's so much bureaucracy. There's so many third-party contractors, and they're just charging whatever. And the states are just like, okay, sure, we'll pay it. And then, it's just not, I don't think it's efficient. I don't. And so I think when you start looking at a lot of these commercial insurance companies, I always keep it real. So, and I work for myself, so I don't have to worry about, anybody coming back and saying, oh, Jessica, we're going to fire you. I work for myself. But I would say, it's crazy because what's really disgusting is when the CEO of United Healthcare was gunned down in the middle of New York City. Mm-hmm. Instead of insurance companies coming back and saying like, man, let's do a survey with our members to see like, how do we like make things better for them? How, like, what kind of ways can we support you more? They had this reactionary response where they just started taking down the pictures of their CEOs. They beefed up security, right. And nothing has changed. And I had a patient who has United, who I had to spend like an hour on the phone trying to get a prior authorization covered for an MRI after the lady had done PT. She had been to a spine. I mean, she did everything she was supposed to do. And so finally, after like spending 2 or 3 hours on that myself, she was finally able to get it approved. It shouldn't be that difficult. I also think that when you start looking at our outcomes are not better. Even though we have all of this technology, they're not better. So now insurance companies are like, hey, we're going to start paying these places to do value-based care. And value-based care sounds good in theory, but you're basically responsible for patients that you may or may not see. And, you split it with the insurance company. So at the end of the year, if you didn't see Mr. So-and-so and he went to the ER 5 times, they want some of their money back. I'll just say this, guys, it's ghetto. It's ghetto, and it can change. And I think that, the problem is that, and I tell my dad this all the time, I'm like, Dad, I love you to death, but your generation sold us out, right? Because once electronic health records happened, and there was all that grant funding and all of that money that they gave for them to start all these computer programs, because it was sort of a reaction to 9/11 when all of these patients were going into hospitals. There was no way to get their medical records. There was no way, for like transfusions and, knowing they're like, man, there has to be something. Doctors testified before Congress and they wanted, electronic health records that could communicate. Now you have probably over 1,000 of them, and most of them don't even talk to each other. Like I literally can't log on now and check to see if a patient who if they saw somebody else, what their records are. So it's really flawed, I think, in general. And so I think 2 ways that I think this can improve. One, I think separating insurance from employers.
Yes.
Because if you go to the marketplace, you got a real ugly HMO plan that's got like a $10,000 deductible, and maybe a $25 copay, and then you look and it's like $2 in your area who accepts it. Or you stay at an employer that you hate because you have a family member or something who needs care and you don't want to have to pay all that out of pocket. That should be separated. And I think secondly, doctors need to start learning the business side of medicine, which is why I got my MBA, because it almost makes you, I wouldn't say an impenetrable superhero, but
it's just, you've got the ethics on both sides of the coin there. So I like that a lot too. And it wasn't until I was in my mid-20s I figured out there was actually laws on the books that prevent you from shopping across state lines for insurance.
Yep. Yeah. President Trump actually he changed it for, I believe, employers, but it hasn't quite changed for consumers just yet.
Yeah, right. So and that's why you've got this veil in front of you of like, oh well, my employer offers insurance, I should be good. There's like 100 of us that work there. Well, what if everyone in your whole industry for, say, the whole Southeast could just band together and shop for insurance? Like United Auto Workers, they get to lobby for their own insurance plans. All the teachers in the state, all the law enforcement in the state, they get to band together. But what if it was regional? That would drop prices.
They have self-funded insurance plans for companies.
Yeah.
So the way that works is they submit their whole roster of people. As they use the insurance, the insurance company sends the bill to the employer so they don't have to pay up front. But that's only available to big companies. So if you're a small company, you can't afford that, and they want all of theirs up front. Like, it just doesn't make sense.
Right. I work for a small company, and I think, to cover, fully cover everybody's family, it's like $3,000 a month per employee.
Correct. It's very expensive.
It's ridiculous.
Yeah, that'll run you out of business.
Well, and then again, you log on to okay, well, what doctor can I go to? And it's not one you'd want to use. It's nowhere around you.
Correct.
It's all based on what's convenient for the insurance company.
Right.
Yeah.
I didn't have insurance from the age of 21 until the age of 36.
Wow.
I still don't.
It was too stinking expensive. And I was like, I'm not buying into any of this. And like I said, you don't even want to go see the doctors because they don't actually do anything good for you.
Right.
It always drives me nuts.
But
the only reason I have insurance now is because Nikki is on the SAG-AFTRA insurance.
And I do get some reimbursal. So I'm with Aetna here in Georgia, and I do get some reimbursal for my osteopath. They've got to issue, they call it a super bill. It's just an itemized.
Yeah, so you pay out of pocket, and then you get reimbursed a certain percent. Okay.
Yeah,
they'll give me like half of it back, which that's way better than zero. So
yeah, and one of the things you touched on when you were talking a minute ago was just the waste, and I think the stat is like 86% of our taxes go to the bureaucracy and only 14% go to the actual things that they say they're going to.
Yeah.
I don't know what like that percentage is in as far as like the medical field, Medicaid, Medicare, and all that kind of stuff. But overall, I mean, that is egregious. Would you say it's about the same like with Medicare or Medicaid, that whole situation?
I think it's a little bit different. So like with Medicare in general, like I would say if you look at the costs of Medicare, one of the things that was very interesting before last year is that Medicare could not negotiate drug prices. Like it was literally written into law. I wonder who did that. Lobbyist who paid someone, hey, send this bill in and, we'll give you this amount toward your campaign. It's like, I say this all the time, like so much of this stuff is pay to play and it hurts people, right? So I would say for Medicare, I would say probably a decent majority of that actually goes toward care of the elderly because a lot of them get hospitalized. They need, end of life care. They need, a lot more medications, things like that. But here's where the waste part comes in, right? And this was a stat from maybe like 3 or 4 years ago, so it may not be 100% on, but or completely accurate at this point. But it was, I think, 20 to 30% of the entire Medicare budget, pharmaceutical budget, was for 10 drugs.
Wow! Wow!
What?
Well, so I know my dad just went for his.
That's one of those
his
drugs
annual,
is weed.
I know my dad just went for his annual checkup with Medicare, and part of it is, he has to get certain vaccines on the schedule to stay on the program.
Wow.
So
does he have an Advantage plan, maybe?
Something. His doctor's cool enough to let him refuse, but what he does is he just squirts it in the trash can and puts a check on the clipboard. He'll just check off the list and squirt it in the trash can.
But if you don't have a doctor like that, then
how much
you're put into a corner there.
Right.
Yeah. And then the doctor's office is just going to send a bill to the insurance for $200 for the shot that got squirted in the trash can.
Yeah.
How much of that goes on?
I would say I don't know how much of that particularly goes on, but I will say that from the perspective of how much extra time people are having to spend just to coordinate insurance benefits and trying to get all of this stuff approved. I will say Medicare is not as bad as the commercial insurance companies. However, they do have a pretty hard stop on what they're going to cover, what they're not going to cover. They cover the U.S. Preventive Task Force guidelines like to a T. They're like, oh, we're not going to cover prostate cancer, screening more than
they
this.
don't like to cover preventative stuff. Just as like a rule, it seems. Yeah.
It's just so it doesn't. And that's why, I think we have to also decide as a country too, is healthcare a privilege or a right? Or like being healthy, is it a privilege or a right, right? Because if you think about it, the more unhealthy people are when they're young, they're going to be more of a burden to taxpayers as they get older. And I don't mean that like in a negative way or, being blunt about it, but just saying like even, when people start talking about Medicaid and like, oh, we want to cut Medicaid and people are like, yeah, they're cheering for it. And it's like, you do know that 50% of that goes to women and children. And then like the other large percentage actually goes to end of life care for those who are on Medicare as a supplement for nursing homes. So it's like, where do we reshuffle that, right? Because I think so many politicians get on, on these stages and we're going to fix healthcare. Then they get in office and they're like, whoa, this is a big problem. Okay, let's just do this. And then we'll like,
Yeah.
It's a big problem, to tackle.
Yeah. Zane, do you want to tackle whether it's a privilege or right? Because
this might come off as really blunt, but I don't know where all the politicians are that are out there saying that we want to cut Medicaid. I wish there were politicians all over the place saying that they were going to cut Medicaid, but the only thing that politicians ever say is, oh, we can't cut Medicare and Medicaid. Like even people that pretend like they're, small government people that want to, rein in the budget, they're all like, well, we can't cut Medicare and Medicaid. This has been, why I've kind of been a bit skeptical of everything that Doge has been up to, because they've come out and said, well, we're going to look for waste, fraud, and abuse, but we can't touch Medicare and Medicaid. I'm like, the only way you're going to be able to cut huge portions of waste, fraud, and abuse is if you go after Medicare and Medicaid. There have been a number of studies that have estimated the total number of wasted spending of Medicare and Medicaid is anywhere between 1/3 and 1/2 of the entire budget. And that's not just people straight up stealing the money through fraud. I mean, it's a little bit of that, but it's,
more inefficiency.
Money being spent on treatments that don't work, have never been shown to actually do anything. payments to doctors are way inflated. You know, we've had this problem ever since Medicare was introduced, which is, you know, the idea behind Medicare is, oh, our seniors need to go to the doctor and we'll just pay it. Well, if the doctors realize it's not the seniors paying for it anymore, it's Uncle Sam, then they're going to increase their prices way higher than they otherwise would have been. You know, before, you can look at, you know, medical prices right before and right after the introduction of Medicare. And right after Medicare is introduced, the prices just skyrocketed because everybody's like, it's payday for all the doctors because the money is not coming from the people that are actually buying the service. It's coming from someone that who can fire up the money printer whenever they need more money for whatever. So I'd say that's a big part of it. I know we were talking about prescription drugs earlier. I mean, the way that the patent laws on the drugs work is just absolutely ridiculous, where you'll have drugs that a lot of people already knew worked and had never even been patented at all, but then a company comes along and says, oh, this was our idea, we're patenting that, and then all of a sudden nobody else can sell it because they've got the patent on it. There's this concept called evergreening, where if a drug company has a patent that's about to expire, then if they make some tiny tweak to it, then they can patent it all over again. It's like what happened several years ago with the EpiPens, where they were about to lose the patent on the EpiPen, and then they're like, right before that, they like changed how the physical pen operated, and they're like, well, we can't let people use the old version of the pen because they might not know how it works, then that's dangerous. So then you can't actually. So now people are banned from
they might not know
selling
how
the drug because they don't know, because the pen itself has gotten a change on its patent. And then like they'll also just way mark it up for the insurance companies, even when they will sell it on a cash basis for way less. So there's this concept of the average wholesale price, which is what the hospitals and the drug companies claim is what people are paying for these drugs, but they're actually not even paying anywhere close to that, and they can just pocket the difference. There's a joke in the industry that this average wholesale price, which is abbreviated AWP, there's a joke in the industry that stands for ain't what's paid, because nobody actually pays that entire price.
Petty Zane. I like it.
That's all.
I'll end on this. Money though. It's hospitals. They charge like $8 for Tylenol. When I see a patient has Medicare, they'll pay me. They actually give us a pricing list, and they say this is what we're going to pay you for this service. No more, no less.
Wow. I have a cousin that's was a chemist for a while and got a job with Baxter Pharmaceuticals, and this was actually his springboard into nursing, because while he was there, just the saline bags, the standard liter saline bags that they have in the hospitals, Baxter Pharmaceuticals said it cost them half a penny to make one of these things. Yeah, because the manufacturing plant's so large, they make so many, they've got the process down such a T. Cost them half a penny. You go get an IV bag in a hospital, $250 minimum
for salt water.
Yeah,
exactly.
And he was like, "What the hell are we doing? Like, how is this even? Like, where's this money going?" He's like, "It's insane." And that was his springboard into nursing, because he's like, I actually want to help people with this stuff. Like,
That's one thing that always blows my mind is when I'm paying for my doctor's visit or what have you, and if it's cash, it's less, and if it's insurance, it's more. Like, that should tip you off right there.
Yeah,
that something's wrong.
That's messed up.
Well, and the ratio too, because it's not like, oh, it's a 5% discount or whatever we save on the credit card transaction. It's like
enormous.
It's like 350%. It's like cash price $100, insurance $500. Like,
have you seen any of these stories where like the person, this will be like a short or a reel or something, where like someone will be like on the phone with their insurance and they're like doing the whole thing in front of, so we can see in real time, and they're like, hey, like, so I got a ride to the hospital and I didn't have my wallet on me because it was an emergency, and so they had this bill and it was like, I don't know, $300 or something, and then they file officially, they say that they're insured, So, and then it's like $1,000. Like it goes up when they actually give their information, and they're like, "Oh no, wait, I have insurance," and they're like, "Oh yeah, of course it's going to go up 2 or 3 times because you have insurance now." Like, and you don't have the benefit of being uninsured, which is like its own thing now.
Oh, the urgent care by my house figured out that I have insurance, and I mean, like they just found. I guess they ran my name or something. They found out that I have insurance.
Yeah.
So I went in there and I was like, I mean, they've got the rates on the wall. They're cool enough to do that.
Mm-hmm.
And
never seen that before.
Yeah, I know. Like, urgent care on my insurance card says $100. Up on the wall says 75. I was like, I'll do 75.
Yeah, it's posted here. Like, why do I got to pay more? Yeah,
I'll do that. So I, did the cash pay, and of course, had to get a steroid shot. That was another $50. Whatever, well worth it. Pay, and then like a month later, I get a bill in the mail for $300, and I'm like, what is this? And they were like, oh, well, we ran it through your insurance. And I'm like, I was cash pay.
Mm-hmm.
Like, I've got a receipt that says this transaction is final. Like,
it'd be like if your credit card like found out you used your debit and was like, no, we're going to put that on your credit card and we're going to charge 21% interest on that. And you're like, no, I paid in debit, motherfucker. Like, I did this for a reason.
But you know what's wild from the provider perspective is that, and I'll leave this insurance company nameless because I've already bashed them enough tonight, but
this is the same space.
It's United Healthcare.
But literally, I got in network with them January 10th, you guys. It took until probably like beginning of March to get paid for any patient that I saw.
Wow. That's
outside of the copay.
Yeah.
So I think there are problems on both sides. Like, insurance companies should not be able to wait a month, 60 days to pay a doctor for seeing a patient when I only got a $20 copay from you. And I probably saw you multiple times in those 60 days.
And again, this is going to hurt smaller businesses more.
Yes.
Because like, big ones can afford to do that.
That's why I do telemedicine. Because if I had a in-person practice right now, as long as they held my money, I'd probably been closed.
Mm-hmm.
That's why it's not enough private doctors that have their own practice. And that's why all of these, like I said, my dad and them, my dad's best friend, I talked to him today. He's like, I heard you say that on a podcast that we sold y'all out. We didn't do that. We just knew what was going to happen. But,
we were just smart enough to get off that boat.
But basically, the problem is that once they introduced the computer systems, and I mean, they were like rudimentary at the time. I'm talking like Meditech when it was like the, computers like this and stuff.
Yeah, the little green on the black screen.
Correct. It made it so complicated. You had to hire IT people. You had to have internet in your practice now. And they already knew that business people were going to come in and swoop that up. And so you've seen that how the patient satisfaction has dropped since private equity companies have taken over healthcare. And so now there's like this resurgence, this new generation, Gen Z, Gen X, whatever they call themselves, they're not going for that. They are not. They're like, nope, I am not about to be working all these hours and doing all this stuff. And I can't take care of my patients. I can't do what I need to do. So that's why it's hard for people to find a primary care doctor, because you have so many people going into surgical specialties.
Yeah.
But even they're fighting for their money.
Oh yeah, I always loved that on the questionnaire too. Like, who's your primary care physician? I'm like, did I come here in a limo? Did I fly in a helicopter? Who's my primary care? You kidding me? Who has one of these?
I will say that one of the many problems with health insurance in particular is, and this isn't an analogy that's unique to me, but it's like if we expected car insurance to pay for your gas, because the way insurance is supposed to work is it only kicks in for the small minority of people that are unfortunate enough to have a huge problem. Right. And so, I mean, I'm sure there are people that don't like their car insurance companies, but you don't have a huge movement of people that are so upset at their car insurance company and are going around murdering car insurance company CEOs, because car insurance is set up the way that insurance is supposed to work. Health insurance, on the other hand, because it's all set up through the employer and all that. Not only do most health insurance plans have to cover literally every single thing that you do for your health, it's actually illegal for them to not do that, because it was either Obamacare or one of the healthcare laws before that actually outlawed catastrophic health insurance coverage. So it's like, the government says, you know how insurance is supposed to work? We're not going to let it work that way for health. We're going to actually we're going to force you to set up insurance in the exact way that it's not supposed to work. And then when the insurance companies don't do a good job at it, we're going to blame the CEOs for being greedy, which I'm sure they are, but I don't think that that's the root of the problem. I think people are expecting it.
Suck though, bro. They really suck. Like, it'll be like, you'll pay like $200 a month and your deductible is like $25,000.
Yeah.
And it doesn't even cover prevention. It doesn't cover anything. So it's like, there's no point for people to pay into something that they can't get any benefit from, especially when you look at how little people are making these days compared to inflation and how jobs are, you know what I mean? So
for most people, that model doesn't make sense.
It doesn't. And that's the only problem. So like I said, I think we need to, one of the companies that's countries that's actually figured it out is Germany. They have like a basic plan for everybody. There's a really good book if you're a bookie like me and want to learn more about the healthcare system. It's called The Healing of America by T.R. Reid. And he travels around the world and checks out every different major healthcare system. And he said Germany by far won because they had a basic plan for covering like prevention, generic medications, if you had like a emergency hospital stay, but if you wanted plastic surgery, if you wanted special things, you could upgrade your plan, but it would cost more. But everybody pays into that pot. And it seems like that's a pretty decent concept. I don't know what it would look like in theory for our country, down in 2025, but I think it's really interesting of a concept.
I like the idea of like prioritizing like the emergency stuff, the main health stuff, and then like if you want more, adding on to it. Like, go ahead, Zane.
That's all I want is the emergency stuff. I'll take care of my health outside of that.
Like if healthcare were like Zane was talking about, like car insurance, but also like house insurance. Like it's for when the tree comes through the roof, not the leaves in the gutter. Like I don't understand anyway. Go ahead, Zane.
So I'll also offer up as an example of a healthcare system working well, the healthcare system of the United States before World War II, which was very well regarded throughout the world as having the best, most advanced care for reasonable prices. And the reason was the government was staying out of how it was set up.
Yeah.
And what you saw was people were able to go to the doctor for in the way that you described, where you had a problem, you go to the doctor, you and the doctor sort it out, and you pay the doctor for the service. And a lot of people will object to that, saying, well, you must want all poor people to die if you don't want a national health insurance scheme. And which is historically ignorant of what actually happened, which is that there were all of these fraternal societies. There was some amount of, union coverage, although not as much as people think. But it was a lot of just friendly societies, and there was some organized, through the companies, but it would be people on their own banding together to negotiate health insurance in a way that actually makes sense, for covering the catastrophic claims. But I mean, this is when you don't do a bunch of stuff that makes healthcare cost a huge amount of money, then you should not be surprised when healthcare actually isn't expensive and people that are middle income and even low income can't afford to use it.
There we go. We have a good comment from the best way for healthcare, I think, to work is Grumpy Gnome wants a doctor that will let him make memes in exchange for service.
You can't beat me with my memes. I dare you to come.
Yeah.
So my GIFs will just blow you away.
That's
what made my dad want to go into medicine. He had a Black doctor that was in their community. He was born at Henderson County Hospital, and their doctor used to come to their house if they had problems. They would pay him, I think $5 or $10, and if they had issues, they could call the doctor, and the doctor had
get a burger to my house for $5 or $10.
Correct. But literally, he had a little hospital in town, so if somebody had to be admitted overnight, he owned the building. It was connected to his hospital. Back during the Obama administration, they actually made it illegal for doctors to own hospitals.
Yep.
Dang.
Really?
And that was when charity care was also outlawed as part of Obamacare.
Right.
Because and back at the pre-World War II times, Zane, and even all the way up into the mid-90s, I mean, Dr. Ron Paul even talks about this. They used to teach that in medical school, was that you were, for a certain portion of your career, you were to donate a quarter of your time on a weekly basis. You're expected to go set up a charity clinic on the poor side of town, because that's what the brotherhood you're joining is, to heal people.
Right.
And there's a retired doctor here in Atlanta, God bless him. He gets arrested every couple of years because he'll go to the homeless camps and start giving physicals, and then they arrest him because he's retired, so he's let his license is expired. But I mean, he's checking blood pressure, he's not writing prescriptions, right? Like, he's just going around like
he's
doing
a danger. He's a menace to society.
Going around,
Yeah.
he's doing physicals and handing out Tylenol and
we're combined.
So it's just, and you look at that aspect of it as well. It's like, how is charity care illegal?
Yeah.
Like, you don't even own your own labor at that
This
point?
reminds me of when we-
I think one of the worst things about Obamacare, I think, that not a lot of people know, but I try to remind people whenever it comes up, is that the incentive of the health insurance companies is for the care to be as expensive as possible, because the Obamacare core regulations, in an attempt to cap the profit that health insurance companies can make it so that the profit that they can earn can only be a certain percentage of the amount that's actually spent on the care, which the idea, when communicated to the hoi polloi, is, well, we can't have the insurance companies pocketing all the money. We've got to limit that so it's only a tiny slice of the money they're actually spending on the care. But because it was actually the health insurance companies that wrote Obamacare, you had to expect that there was something in it for them. And the thing is, the way you make the profit percentage that you can make it be more in absolute dollar terms is if the care itself is higher in dollar terms, which means that the companies want their own product to be more expensive because that's how they make more money, which is so counter to how the free market is supposed to be.
It's only a certain percentage, but then when you just inflate the entire price of the service, it doesn't matter, because
that's why they don't give PPO plans on the ACA plan, because HMO patients have to go to their doctor for everything before they can get a referral.
Yep.
Like, so if I had a HMO plan, so my son has autism, and so Texas actually is one of the states. I will forever be a Texan, forever be grateful to be a Texan. I told you, we live in New York because of, all of the services that are just way more robust for children with autism. But we were actually able to purchase him his own insurance healthcare plan through the marketplace in Texas. Texas is one of the few states where kids can have their own insurance plan without their parents on it. But he had an HMO plan. So every time we needed to renew his referral, they would only let it last for 6 months. Where are we going? Back to the doctor's office for him to act a fool in there, because they're like, okay, we're going to check you out and listen to you. I'm like, we literally just need a referral. Like, but you're paying out every time. So it's all predatory. If you follow the money, that's where all of this stuff goes. You follow the lobbyists, you get to see that they're the ones writing the bills. You get to see they're the ones that are saying, hey, I'll donate this amount to your campaign if you do this.
It's so intermingled between the private and the public side of it and everything. And they're just scratching each other's backs all day. And then we just get lost in it. And like you had said before, it's both like doctor and patient, I think, are losing out. It's, sometimes like hospitals, like as an entity, like will do well, or like insurance companies or something like that. But like doctors and patients are not like typically the winners here.
We're not winning.
Yeah.
Well, I mean, hospitals have figured out as well how to keep competition down with certificate of need laws and all that kind of stuff, which is
Did we cover that at one point on here? Because that sounds familiar.
Yeah, we've talked about certificate of need laws.
Yeah, that's crazy. Like, I mean, they literally make it to where if a doctor has their own clinic and say, you know what, I'll just admit you overnight. I'll hire a nurse to stay with you. I'll be on call. And it might be like $100 a day or something like that. And you can buy the medication off Henry Schein for like $4 a bottle. You can buy an IV bag for like 10. I mean,
a penny. Yeah.
I mean, like it doesn't make sense. And so that's why you see all of these like freestanding ERs and they're like, oh, we're available this time. And then, they go in and then the insurance plans are like, we're not going to pay for that. And then the patients get shafted with that too. So it's all of the quick fixes in healthcare have not worked. And I think a lot of those charges have been led by business people who don't really understand what doctors nor patients need. And so that's why you see so many doctors now that are charging cash for memberships where patients just pay them a flat fee. They go to them. I was looking at some of our numbers the other day. I refer out less than 5% of my patients.
Wow.
That's low.
awesome.
You don't need it.
Yeah.
If we do the workup, I'm gonna listen to you and find out what you're saying. Even my dad, he's been practicing for 45 years. That man has never been sued. Let me knock on wood.
All right. Yeah.
Like never been sued. And he says, I don't care how much you know until they know how much you care. So he's
I like this.
Smartest brain surgeon in the world. If you are an a-hole, people are only going to come to you if they absolutely have to. If you're a good primary care doctor, he said, my dad used to play football. So he's like, you're the quarterback. Like, I remember when I graduated from medical school, he gave me like this whole like spiel. He was like, we both were at my graduation party. We're tipsy. He's crying because I'm about to and everything. And he's like, listen, he's like, think of yourself like the quarterback. It's your job to get the patient to where they need to be. He was like, you don't need to just hear what the patient says and say, oh, I'm going to refer you to this person. No, you need to listen to it, work it up, be a good doctor, be a sleuth. He's like, Inspector Gadget, when I'm talking to my patients, I'm like, I'm asking those intuitive questions so I can know what they actually need rather than just pushing them off to a specialist. So by the time I send them, the specialist like, oh yeah, they need to be here. Thank you for thank you for sending them. You didn't send me.
So my doctor doesn't take insurance at all. So I'm wondering how you said y'all now work with insurance, right?
Yeah, we've always worked with insurance. I did a health policy fellowship, so I would say I'm a little bit more sensitive to the whole cash pay thing because I think looking at, and this isn't like getting into race specifically, but looking at, just like lower income families and working collar and blue collar families, looking at their ability to have cash that's just available on hand for that to go to a recurring payment. I've never wanted to actually do that to anyone. And so like I tried concierge for a little bit, but what was crazy is my concierge patients bothered me less than the patients who had insurance. So I was like, this is like crazy. Like I'm working less with the patients, so I think the problem is it's not a large enough scale response in order to get healthcare to enough people, if that makes sense. So like most direct primary care doctors, they'll have a panel of maybe like 300 to 800 patients a year. And so these patients are paying in. So the doctor is just kind of like sitting back waiting for them to come in, which is great. But then who wants to be on call 24/7? What kind of lifestyle is that actually, right? And so with me, I take insurance. I'm open usually from like 10. I'm not a morning person. So patients like, Dr. Evans, are you open at 7? Hell no.
Yeah.
I don't do that. I got to get my son ready for school. And then I'm taking a nap because we had to fight with him to get on the bus and bribe him. And, I'm like, I need a nap after that. But, we're open from like 10 a.m. to 7 p.m. And so my patients are so thankful because they're getting off work. I've had some patients, they'll be driving in their car and I'm like, don't look at me. Turn me off and focus on the road. What are you doing? I'm like, I'll talk to you, but you can I'm actually reaching patients where there are. I'm open on Saturday mornings. My dad covers for me on Sunday mornings, even though he's kind of afraid of the computer. I said, Dad, you're doing fine. Like, don't worry about it. But so it's about having that accessibility because if my patients know that when they need me, they can book an appointment, they'll do it. When I walked in, my office was right down the hallway from my bedroom. But anyway, when I walked into my office this morning, I had like 2 appointments scheduled this morning. By the time I finished, right before I got on with you guys, I had 11 because patients can access us when they need it. They were able to go right to the website, book within an hour of their visit, and they got what they needed.
Wow. That's amazing. Yeah. I really like that. I love the idea of being open after most people's work ends.
Right.
That's you get better blood pressure readings then anyways. I mean, like that's
correct. I mean, you're not wrong.
I've been having to track mine recently, and like I had to quit taking it first thing in the morning. Like first 2 hours I'm awake, get that cuff away from me. We're gonna come back at 5:30 in the afternoon, and my number's gonna be fine.
I just did mine in Publix, but I did it like on a Sunday when we were like, oh, you know what? I forgot like, one item, and we just run up there and I'm not doing anything stressful. And I sat down and did it. First time I did it in like 8 years or some shit. And Haley, my girlfriend, was like, those are good numbers. And I'm like, I don't know. I'm relaxed right now. Like I'm not doing anything. You know what I mean? You caught me on another time. Who knows what it would have been? But when you just poke up to Publix, like then it's fine. I don't know.
So you talk about, doing the insurance thing. And this is kind of a silly question here, but versus the cash pay people. So I've seen reports this week that DoorDash has just partnered with Klarna. Have you ever thought of partnering with like?
I actually take Afterpay because I actually had a patient yesterday. It was so sad. I hadn't talked to her in a few months, and she sent a message to my staff before, and she said, "Dr. Edwards, I've been through a lot. Do you mind if I don't pay my copay right now?" And I was like, cool. I said, it's not a problem. I hopped on with them, and they, were homeless. Their medication, they had to like leave their house. They couldn't afford the rent. They got kicked out. Their medication, all of their medications were still in there. I mean, they were just like getting them out of there. And so needed to completely represcribe their medications. And it's like when things like that happen, having the leeway to be able to say, yes, we can do it later. It's fine. I think has been a real blessing for me, because trying to make people pay everything up front when sometimes people are choosing between seeing you and getting groceries for their family is never where I want to be as a clinician. So when my patients are like, hey, I need to pay later, I'm like, cool. So we have Square. So we take Zelle, Cash App, Afterpay, and Square has all that set up. But I think that is something that more doctors should do, especially for those who don't have insurance, because it gives them more time to be able to pay it off later.
Yeah.
And start accepting Bitcoin, because that would be
get
me on board.
I just used Bitcoin for the first time like 3 weeks ago. It was
so
cool. It was so cool. I was like, oh my gosh, I don't have to type in all this information. I just like did it. And then I told my dad about it. He's like, oh yeah, I have like almost $100,000 worth of Bitcoin. I was like,
oh shit.
Way to go, Dad.
You didn't even tell me what is going on. Like,
I've tried to tell my dad about Bitcoin, and he goes, just stop talking. I don't want to hear it.
Oh my God. Yeah.
my husband actually missed out on an opportunity. When he was at Rutgers, he had he was in the business school, obviously. So like some of the brightest minds from all over the country. Rutgers is one of the most like diverse colleges in the country. They were trying to get him to come in on Bitcoin because they were going to do an investment and buy a whole one together and just kind of let it grow. And my husband was like, well, we didn't really understand much about it. Yeah, and now those guys don't work anymore. And I'm like,
yeah.
Right. Yeah, I was at a bar with some buddies in 2011, and we were just like, oh, we should all, there's 5 of us together. We're like, we should throw $1,000 at Bitcoin and just see where it goes. And of course we're all
like $14 a coin back then. Maybe that. Yeah.
It was significant, and there's 5 of us, so it'd been $200 a piece. And of course, we're all in our late 20s, and we decided that was too much money as we all eat chicken wings, smoke cigarettes, and drink pitchers of beer.
Yeah.
It's probably cheap beer, though.
Nope. I was drinking IPAs back then.
Yeah, of course you were.
So, yeah, I mean, I did the math on it recently. Like, if we went in then, like, my share of it last year would have been a little over $400,000.
Oh, I know that hurt. Oh,
it just makes me sick to think about it.
Oh my God.
So Dr. Edwards, so I go to my osteopath, and they have private label supplements. Mm-hmm. And I know, so you mentioned, doing a fellowship up in Jersey City. You're up there in New York. I know. I mean, I'm real big into natural supplements, nutraceuticals, that kind of thing. And I know our biggest manufacturers in the country, aside from in California, are in New York and New Jersey, in that area. So do you private label your own supplements for your patients?
I haven't labeled too many just yet, because one, I'm very particular about making sure that like the ingredients are the best. I have some supplements that I really have seen that are evidence-based, and they've been studied, and they're really, really effective. That's probably like on the radar next year, because people always ask me that. They're like, Dr. Edwards, if you come up with supplements, I'm going to buy it. It's so crazy you were talking about that. My husband brought that up in our business meeting the other day. He's like, you really should think about all these supplements. He was like, I hear you talking about this supplement or that supplement. You should make your own. And I was like, And so it's so crazy. It feels like confirmation that you said that, because right before I got on this call, I was talking to a patient who was a relatively young guy, and his cholesterol was elevated. And so we were talking about, how to bring it down, and he didn't have a strong family history of like heart disease or, high cholesterol. So I'm like, you know what? I was like, I'm going to send you some information about red yeast rice. And so it's a traditional Chinese herb medicine that can help to lower the cholesterol, because it has an active ingredient of lovastatin, which is one of the cholesterol medications on the market, without all the side effects. Mm-hmm. And so I was talking to him about it. And so he's like, man, that's interesting. I really want to read up on it. And so I sent him like the NIH article that was showing like it was evidence-based research back. And he's like, you know what, I'm going to try that and we'll give it 3 months. And I'm like, cool. And so whenever I have the opportunity to not have to prescribe medication, that is what I will do. And then also for a lot of women who have menopausal symptoms, there's a really good product by a company called Metagenics. I like a lot of their products. They do have where you can actually like label it yourself. And that's been something I've been thinking about, but they have a plant-based menopause supplement for women. So there are some women who can't take hormones because of other risk factors. And this is a plant-based supplement. It's been studied for years overseas, and they just let it into the States probably like 5 or 6 years ago.
That's interesting.
Nice.
Wow. Your story about the cholesterol and everything reminds me of like one of my I think my first as an adult doctor story.
Are you an adult?
No, exactly. I'm a lost boy. Yeah.
Okay, there we go.
I don't want to grow up. I still don't have insurance, so if that tells you anything. But my parents were like, you should go to a doctor just to get checked up. And I'm like, I don't wanna, and then eventually they were like, go to our doctor. We like him. He's fine. But I had given all my concerns about the medical field and just doctors in general. And I'm just like, I don't know if this is going to work for me. And they're like, no. We really like our doctor. And I'm like, fine. If it gets you to shut up, I'll go. And so I go to this guy and he does the, labs and whatever. And then he's like, your cholesterol is a little high. And before anything, I was like, I don't want to be prescribed anything. I want to talk first about lifestyle, diet, exercise, nutrition, things like that. And then if that doesn't work, then we can talk about other things or whatever. I was 22 or something at the time. And the first thing he did was I'm going to prescribe you some, statin or whatever. And I was like, nope, I never went back. That was a bad taste in the mouth story for me, with my experience where I'm like, you didn't listen one fucking iota to what I was saying. Prescribed me a statin at 22 years old.
Right. Something you never come off of.
Liver disease from a statin, you know what I mean? Just literally almost died from it. Never mind. Go ahead, Ms. Steele. I'm sorry.
Well, it's almost a guarantee with statins. If you're on them for 20 years or more, it's almost a guarantee you're going to have either diabetes or Alzheimer's.
The side effects are
that's a British Medical Journal study. It was one of the most comprehensive medical studies on the planet. Yeah.
Yep.
Holy crap!
Statins are absolute freaking garbage.
It is honestly a last resort, even for me.
A
lot of young healthy patients who come to see me, their cholesterol is a bit elevated. I'm like, all right, let's talk about what you're eating. But I actually have that time. So imagine doctors that are working in these hospital settings where they're having these patients on their schedule. Nobody's stratified. There's not real triage, and they're walking in and it's like, okay, I'm going to have to try to handle this patient's got 10 or 15 medications. They can't get in with me for another 3 months. That's why they're running behind, because they're trying to address so many. It's just, it's a mess. And I think business people have really dropped the ball when it comes to healthcare. I think the fact that the pharmaceutical companies have to front all of the money for a lot of the drug studies that they do, that's why they come back and they can just list every price. Just like medications like Zepbound, Wegovy, all of the GLP-1s, the GIPs, they charge people $1,500 if their insurance doesn't cover it. But then if they just decide to pay cash, it's $349.
And then another way so we were talking about before, the intermingling of government and business and different levels that just convolute this to the point where it doesn't work. Some studies you can't trust. Most studies are funded either in an obvious way or by funding a group that is some conglomerate of different corporations that will be oh, we're the National Institute of Health and we want to save your ass and whatever the name. And it's really Coke and Pepsi and whatever. And they'll fund some study through this proxy organization. And they'll be yeah, but we want you to basically find that it's not sugar that's the problem, right? Like, and then it'll be something where it's like, oh, fats make you fat. And then really behind the scenes, it's all the other studies that like don't get the government grants because they're not playing the game.
It's impossible to get grants, bro. If you're a private practice, it's impossible to get grants.
Yeah.
We're going to apply for an NIH grant because we wrote up an entire curriculum for a telehealth fellowship for young doctors coming out that were in primary care. I'm like, listen, we want to pay you a PGY4 salary, which is, like the year after residency, a 3-year family medicine residency. We want to pay for you to get your own personal branding. We want you to get your MBA. We want to teach you the business side of medicine. We want to make you a junior medical assistant. They didn't even look at our application.
Wow.
Yeah.
Well, and that's like, so what was it? Dr. Judy Mikovits. Now, of course, she's got some political clout behind her, after the whole COVID stuff, but like pre-COVID, she was going toe to toe with Dr. Fauci in the early 2000s because she published a paper just asking questions. Okay. So she postulated that there was a retrovirus causing chronic fatigue syndrome in women. That was it. It was a postulation. It was, I'm asking a question. There's some data there that hints that we need to do some more research to get to the bottom of this.
We have a correlation. Let's see if it's a causation.
That's exactly right. But because this retrovirus, it was XMRV retrovirus. It was in some of the treatments, I think it was in like the depot shot or something like that was causing chronic fatigue syndrome in women. She was like, we need to research this. And Fauci,
he shut that down. Fauci
not only stepped on it, stripped over medical license, and had her thrown in prison.
Yeah. I think I know this story, actually. I think RFK Jr. talked about that in his book about Fauci.
Yeah. So, I mean, if you challenge the establishment with a credible scientific study, I mean, look at Dr. Andrew Wakefield, right? The whole, because he never said vaccines cause autism. All he said
causation or some link for it that needs to be studied.
All he said was, I had patients. This kid was not autistic. He gets around to vaccines. He comes back a month later. He's autistic. We need to look into this. And it had something to do with their gut flora was like drastically imbalanced after rounds of certain shots. And he was like, this needs to be studied more. And just for saying that, they were right.
His license too.
Speaking of causation,
stated recently, he finally got back.
Going back to the cholesterol thing, I'm no doctor and I don't know, but I've heard other people smarter than me talking about that actually cholesterol might be more of a sign of the body fighting inflammation, and the cholesterol is almost kind of like white blood cells attacking a thing. And it's like when you get that clog of the platelets, if you just keep treating the cholesterol, you're like almost like just being like, no, let's knock the white blood cell count down instead of like treating the infection.
Yep.
And so again, we're a country that doesn't want to do preventative care, and we just want to treat the symptom, because that's a lifelong thing. If you treat the source, if you cure the damn thing,
correct,
you don't have a patient for life. And so that's just one example of a.
No, but you're right. That's why medications like Zepbound, Wegovy, I mean, it's literally reversing diseases. Like I see people who go from being morbidly obese to like in the overweight BMI range of like 25 to 29.
Are you fat shaming right now?
Huh?
No, I'm sorry.
But seriously, like, I mean, I've seen, and it's not for everybody. Like, I'm not, somebody that pushes medication on people, but there's some people who haven't been able to lose weight, even though they've been doing all the right things, and they get on these medications. The prediabetes goes away. The cholesterol levels decrease drastically. They're sleeping better. They're actually able to function better. And they're like, I feel so great. That is like, why is that like behind the red tape?
Yeah.
There's no reason.
Yeah. Well, there are some side effects with the GLP-1.
Some of them, yeah. The GIP ones are way better though.
Yeah. I mean, some of those, because my sister-in-law is a surgeon, and they talk about this kind of stuff too, because she's actually seen some cases when she was doing her residency. Some of them, like their bowels just shut down. They just shut off. And like,
I hear you need those.
But it's one of those where, like, you know what else is deadly? It also kill you pretty quick though, right? Being 5'2" and 450 pounds.
Yeah.
So it's
And some of my patients, they live in the hood, so they can't do late night walks.
Right.
That's totally fair.
We all live, or most of us live in Atlanta. We can't do late night walks either.
Yeah.
But yeah, I mean, like some of them, I have patients who live in Chicago and they're like, yeah, I can't do a neighborhood.
Oh yeah.
Like,
Yeah.
it's
That's
just,
fair.
it's kind of, some of those things. So I think, just in general, I think as a country, we need to do a better job at covering prevention. We need to do a better job at making sure that the basic needs of people, being able to go to your primary care doctor, being able to get, your screenings for cancer and things like that are covered. Now, if you want to go get lipo, tummy tuck, BBL, whatever, we don't
That's
cover.
all extra.
That's something else you got to pay for if you want, but I think the basic things I think we need to figure out.
That's an investment. And we were just talking about this earlier with things that become a burden to the system. And if you let all of these things just run rampant, by the time someone gets older, they're going to need vastly more help and sooner and more expensive. And like I said, Haley works in more of the mental health care field, but there are things that we just ignore, and people don't want to spend, the time or the money on something like helping someone with schizophrenia. And then you get like 100 emergency calls, and like they got to send emergency services out and like fire trucks and ambulances and cops, and like that shit gets expensive and honestly way more. So anyway.
Yeah.
Yep.
Well,
We're gonna move on, buddy.
Okay, sorry.
Is that all good with everybody? We can address some more.
Oh, I had one more irrelevant tangent to go down.
You want me to come back again?
Yeah, we'll talk more in the cleanup crew section, but for now, we're gonna go do trivia, everybody.
I need my trivia refill. I'll be right back.
All right, let me get us in the right spots. I gotta go get my.
Yeah, I'm gonna try though, guys.
Hey, don't you worry. Actually, Nick isn't here, so everybody has a chance, but the audience is going to win. We've recently remodeled our trivia, and now the audience has been smoking us recently. So, I got to get my board.
Where's Hannah? I don't see Hannah tonight, though. She's usually the one that really socks it to us.
She has a tendency of just showing up for trivia right in time, so... anyhow, while everybody's getting situated, welcome to another week of Libations Trivia. As usual, it's trivia in 3 rounds. Round 1 is 8 questions, 1 point each. Round 2 is 6 questions, 2 points each. Round 3 is 4 questions, 3 points each. Our
what if I
panelists
didn't know
here
the
will...
rules, Zane?
Well, too bad. Our panelists here will answer by writing down their answer on a whiteboard or a sheet of paper and holding them up to the camera once time is up. As usual, if you are in the audience, please write your answer in the chat. And if any of you get it right, then the audience will also get the point.
Also, make sure, audience, you get 1 answer per audience member. You cannot just be bombarding the chat with
Stop
answers.
spamming. They win anyway every time.
We will take your first answer and no answer after that. That's basically what it is.
All right, Alden, have you shaken your pen enough times there?
Is that a euphemism, or are you talking about that?
Ew. Okay.
Sorry.
It is mightier than the sword.
I'm on my, I don't know how many tequilas. It's too many.
The audience is asking if they can have 1 joke answer plus 1 real answer per person.
I actually approve this.
No. If you want to make a joke, that's your answer.
Jake is not going for that.
I like it, but I'm here for just a good time. So I'm just an idiot.
You're here to lose. That's what it is.
I am going to lose.
All right. Tonight's categories. Round 1, I've got 8 more haikus for you all.
All right.
Round 2, all about April Fool's Day. And round 3, entering the chat.
What does that mean?
I guess we'll find out.
All right. Round 1. George Armstrong Custer, last in his class at West Point, died in this battle.
12 seconds.
Grumpy, you don't have to know how to do haikus in order to answer the question. The question is just a question.
I feel like Grumpy posted a GIF.
All right. Time's up.
All right, Steven.
All right. I said Custer's Last Stand.
Jessica.
I probably totally messed this up. I think I put Battle of Gettysburg. I don't know.
Yeah.
Jake.
Custer's Last Stand.
Alden.
I feel like such an idiot too because I also did Gettysburg. But...
Okay, I don't feel bad now.
No, yeah.
Zach says Guadalcanal, and
You're not alone.
Grumpy has the obligatory Jackie Chan.
This is a long-standing joke.
I don't actually know if Custer was at the Battle of Gettysburg. He would have been pretty young at that point. But this is the Battle of Little Bighorn.
Oh, it was neither. Okay.
Also known as Custer's Last Stand.
Oh,
I
okay.
could not remember what Little Bighorn was. Yeah.
I almost put Big Little Horn.
Question 2.
No, that's a rapper.
Kiefer Sutherland proved in this TV series, torture always works.
12 seconds. I don't know why I'm saying 12 seconds each time.
Yeah, like 12.
4, 3, 2, 1.
Alden.
Why'd you start with me? I haven't even written anything.
Start with Steven.
Steven.
24.
Jessica.
Holy screwed that up. I put Dexter.
Jake.
Oh,
24.
Alden.
12. Do I get a half point if I say 12?
Audience says 24 as well. It's 24.
Yeah, boy.
I know where you got Dexter from, though. That show's awesome.
yeah. Dexter was Michael
Dexter
Hall, right?
started out
Michael
awesome.
C. Hall, yeah.
Yeah.
It was okay.
I only know I don't watch a lot of TV, so I know Kiefer Sutherland more from like movie roles. But
Lost
I only
Boys.
know him from the show. What's the one that's on TV? Designated Survivor.
Yeah. He's in
The one
that.
that I remember him from. Okay.
mm.
I need to do more trivia. Okay, I'm gonna start playing with y'all.
Well, this is Zane's like pro level, so like he's not a good place to like start trivia.
Alden knows because he's never won.
I don't win.
Question 3. Scenic Mountain Road, almost 500 miles in VA, NC.
Dadgummit.
9 seconds.
I've never driven on this one in particular, but I have been on I-77, which is pretty much in the same region.
All right, time's
So
up.
it's not 77.
All
It
right,
really narrows it
Steven,
down.
Blue Ridge Parkway.
Damn it!
Jessica,
I said Appalachian Trail.
That's what I said.
I mean, if you can get a car on there, it is scenic. I said 24.
it is the Blue Ridge Parkway.
Yeah.
Audience gets it as well. Zach says Highway 41. Is that a thing?
That's right where I live. I live like right off of 41, and I almost said it just because I'm so familiar with it.
Alden, what's
Yeah,
your
for-
address? You want to say it on the air?
Yeah, I'll say my address. Yeah. I almost did
Yeah,
it.
for fellow Metro Atlanta residents, 41 is like Cobb Parkway.
Right.
You want to read back my social to me too while we're on air?
I can if you want me to.
Mm-hmm.
462. I had to make sure before I did that joke that I didn't accidentally say that the first three numbers of my actual SSN. So I'm glad I didn't do that.
I don't think the first three matter.
Question 4. World holding being, according to some legends. Crush, Finding Nemo.
What? World holding being. I don't know. Three, 2, 1.
Steven,
All right. I'm going with Atlas.
Jessica,
No idea.
I went with Atlas as well.
That's what I said
Yeah.
too, but I don't get where the fish movie.
The audience
into that.
says turtle.
and that would be right.
Oh
my
no!
What?
Wow. Okay.
What? What is
Crush
that?
On the back of the
Crush
turtle.
from Finding Nemo is the turtle.
Oh,
Oh, yeah.
Crush, the stoner turtle.
Yeah.
And this is a picture of the world turtle, which is a figure in multiple different
Yeah.
legends.
Yeah.
Really?
That's what the flat earthers talk about too. Yeah.
It's a soft shell turtle. Yeah. There's a whole thing on that with like the Native Americans used to talk about like the turtle's back and like it being the calendar, and then the whole theory with like the 28 days and the lunar cycle, and there's like a missing 13th month and all of that, but whatever.
Yeah, exactly.
So you would think I would have known this, but I didn't know this.
Yeah.
I love how you were able to explain the answer after not getting it.
Right.
That's my specialty, I think.
Question 5. Type of poetry, 3 quatrains and a couplet. Shakespeare wrote a lot.
Easy.
I know it, and I can't remember it.
Me either.
I don't think tequila is a performance-enhancing drug.
All right, time's up.
Steven,
I went with sonnet.
Oh, dadgummit.
Jessica,
I ain't got nothing for you.
I
Jake,
said iambic pentameter.
Alden.
I also
That's
said
meter and
sonnet.
verse.
Shut your mouth, Steven.
It is the sonnet.
Yeah.
Hey, I got one.
Iambic pentameter is 10 syllables
5.
per line with the alternating stress. So like da 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 da.
Hey, listen.
Yeah.
I don't need 2 people to explain to me why my answer was wrong. I know it was wrong. I'll go look it up if I want to know why.
You were born
Tired.
missing
You're
a
good at-
chromosome.
I see why they don't let you play no more. Mhm.
Question 6. Fearsome mascot of BYU, Washington State, and my middle school.
If someone gets it because of your middle school, I'm going to be very upset.
If someone gets it because they know where I went to middle school, I would be very afraid for my social security number. No, that's a fact I just put in there to make the poetry work.
That's funny. All right, time's up.
I can't get my pen to work. Hold on. Okay, I got it. I think I need a new pen.
Even
Freaking loudest pen ever.
I
Wolves.
know.
Jessica,
I put bulldogs. I don't.
Jake,
It's the Cougars, y'all.
Oh, I said mountain lion, but that's like the same.
The audience didn't get it either. They said Huskies, Wolverines, Beaver.
Oh, cougar and a mountain lion are like the same damn animal.
No, they're not. No,
They
they're not.
literally are, though.
No, they literally aren't. They're 2 different names.
Idiot and Jake are the same thing. They literally are.
Well, that I'll agree
Prove me
with.
wrong. Prove me wrong.
No one can.
There's a
Question
famous
7.
you guys' city, Carly Red.
What's that?
There's a famous cougar right in you guys' city. Her name is Carly Red from
Really?
Atlanta.
Yeah.
That's good.
Question 7. 1/3 height times pi times square of the radius. What solid's volume?
Lord, I'm gonna kill you.
You fired, Zane.
I mean, what?
You're off. That's from Friday, by the way.
That's such a good movie.
Well, we know it's not an irregular polygon because it's not the apotheme.
3, 2, 1. Answer.
Steven,
I'm gonna go with the cylinder.
Jessica,
I put 1. I don't know.
Perfect.
Jake,
I put cylinder as well.
Alden,
I was gonna put cylinder, and then I was like 1/3 the height. I went cone.
big brain Alden over here.
It's that tequila. It's really firing me up.
It is the 1/3 that's the difference between the cone and the
Yeah.
cylinder.
Yep.
Okay.
I was just guessing shapes.
Question 8. Chinese billionaire co-founded Alibaba, grand retirement. And this is a photo of him at his retirement party dressed as a rock star doing that.
Nice.
I do not know his name.
I do.
Almost everybody would recognize him, but Remembering his name is a tough one.
Yep.
5,
Goddamn
4,
style.
This pen
3,
is dumb.
Yeah,
2,
that too. That's what I was gonna write down.
1.
Steven,
Jack Ma.
Jessica,
I put unknown individual.
Jake,
Jack Ma.
Alden,
Everyone knows it's Jackie Chan.
Yeah. Audience says Jackie Chan and
Yeah.
Wee Woo.
it is Jack Ma.
You sure it's not Jackie Chan?
I'm so glad Nick's not here. I actually have a shot to win. It's crazy.
It is, that is true, actually.
I know.
So we've got Steven leading the way with 5, Jake and the audience was 4, and Alden was 2.
Hey, I'm on
Oh,
board.
Jessica, you got to get on the board. Come on.
I don't know this stuff. I don't do trivia.
I-
I'm learning though. I'm gonna get good at it. I'm gonna keep practicing.
When you're back on the next time, you're gonna smoke.
I'll be better.
Yeah.
Any scoring disputes?
Not that I know.
Actually, I shouldn't have even asked.
Should I get a half point because Jack is in
No.
Jackie Chan?
No.
I think a cougar is in the wolf family, actually.
A cougar is in the wolf. A cougar is in the MILF family, actually.
All right. Round 2, April Fool's Day.
Zane can't handle it.
On April 1st, 1957, a BBC program purported to show footage of Swiss farmers harvesting what food from trees?
What?
This is one of the most famous April Fool's Day hoaxes of all time.
Man,
BBC
we're never
program.
gonna be friends.
Show footage of Swiss farmers harvesting.
Man, I need a new marker.
That's the loudest marker I've ever heard.
It's the deadest marker.
Squeaky.
5, 4, 3, 2, 1.
All right, Steven,
I said, oh, where is it? Potatoes.
Jessica,
I have no idea.
Jake,
I said chocolate.
Alden,
I'm on the same train. I did Swiss rolls.
Oh.
Audience says marshmallows, bread, tomatoes.
I've never heard of this story.
spaghetti noodles.
Obviously from
Oh.
trees.
Wow.
BBC. They were about as right as that as they were Building 7.
I've got to say, X on April Fools is the worst place to be. X and Instagram, just social media in general.
Oh, I thought you were like, don't be high on Molly on April Fool's Day. I was like, why? That sounds like a great time. I don't understand.
Everything is stupid, and I never know what to believe on
Yeah.
any social
yeah.
media.
Oh yeah,
Crazy.
right.
I actually called a buddy of mine that lives 30 minutes south of me. I was like, dude, there's a nudist colony moving to your town. Like, what? I was like, yeah, there's this whole story about it. Like, it's got 1,000 shares already. Like they're buying 100 acres.
The news anymore,
Yeah.
I just always hope it's April Fool's Day, but it's the real world. So
All right. Question 2. In France, April Fool's Day is known as Poisson d'Avril in reference to what animal?
A poisson.
you know what? I'm getting a new pen.
Squeaky wheel.
Poisson.
Damn, I should have watched more Emily in Paris, y'all. Dang it.
Right?
It's actually a tradition in France on April Fool's Day to tape a paper cutout of this animal onto people's backs and wait how long it takes for them to notice.
Oh, we got to do that here. That's
Oh,
hilarious.
yeah. Okay, yeah.
All right. Time's up.
Hey, this pen works.
All right, Steven,
That's a fish.
Jessica,
Put a possum.
Jake,
Oh, that's a good guess.
I put a fish.
Alden,
Where are you guys both getting fish? Is it just fish? I did squirrel because I have no idea.
Fish, snake, pigeon.
Poisson.
It is.
I don't know.
a fish.
Darn
Ah,
it.
really?
Yep.
I took French
Oh shit!
for 1 year, and then I hated it and quit.
I did 2.5.
I took German
Question
for 3.
three.
Can't speak any German, so
Entschuldigen Sie, ich verstehe nur ein bisschen Deutsch.
Nice.
This meme made the rounds in late March 2020, although fortunately for the banks, it did not cause a bank run. Had a bank run occurred, it would have been made even worse by the fact that, effective March 26, 2020, the Federal Reserve eliminated what requirement on banks? And for our audio listeners, the meme is a picture of a Fortnite guy, and it says, on April 1st, let's take out all our money from the banks. The look on their face will be hilarious. And I'll leave it to you guys to figure out what was happening in late March 2020 that would have made this a funny thing to be doing.
Time's up. Sorry, I was writing out a whole paragraph to correct what Zane wrote.
We'll see about that. Steven?
Fractional reserve?
Jessica?
I'll put they don't want to let people take out. They don't let people take out all the money in their account.
All right.
I mean, technically that is correct. Yeah, I said fractional reserves, but then they reinstated it at 10% again, which they did.
Alden?
I put the holding the 10%, the fractional reserve rule or whatever.
I was not aware that it had come back since then, but it is that they eliminated the reserve requirement.
It came back within a year.
I have it from a good source that Chase Bank keeps more on hand than most other banks do. They actually go above the requirement.
Oh man, they go above
and beyond
10% that they're supposed to.
But they are also co-owners of the Federal Reserve. So
what a great bank it is. That's amazing.
Well, if you co-own the Federal Reserve, it's like you always have an infinity % reserve at your fingertips.
Exactly.
All right. In case you didn't know, Jessica, we're all econ nerds around here. So.
No, not all of us.
Okay, 3 of us are.
There's 3 econ nerds and a drunk.
Told me not to play the trivia, but I didn't want to be a jerk guest. I'm just sitting here gently getting my ass tapped. I'm and I don't have enough time to chat GPT it, so I'm just rolling with it.
No, I'm surprised I even got that one, or I guess I got that one.
Question 4. In 2016, a Google April Fool's Day joke allowed Gmail users to respond to emails with a GIF of a minion doing what action? Google apologized after many users sent the GIF to their bosses by mistake.
I have no idea. 5, 4, 3, 2, 1.
Steven?
I said mooning, showing cheek.
Jessica?
Actually, that would have been good.
Finger.
What?
Middle finger.
Oh, Jake?
I said flipping the bird.
Alden?
I was gonna say mooning specifically, but I did the general flashing.
Some quack says twerking, which
Twerking.
I like that answer the most.
Minion twerking.
Yeah.
All very good answers, but this is Google, so it couldn't be too off the rails. This is doing a mic drop. There was a button that said drop the mic that did that.
That's lame.
Trevor, you're fired.
Google sucks. That was ridiculous.
Question 5. What 2 television hosts switched hosting duties for one day on April 1st, 1997?
Oh God,
Dang,
1997.
where are you getting these questions from?
Where indeed?
2 television.
There we go.
5, 4, 3, 2, 1.
Steven?
All right, so I'm repping the Atlanta Morning News on this one with Mark Aram and Fred Blankenship.
See you then.
if that's it, I'll never have known that. So
Even I'm not that diabolical.
I put Oprah and Jerry Springer.
I love that guess. Gosh, what a crazy switch that would be. That's so good.
Oh my god, that's the greatest thing I've ever heard. That would be amazing.
I said Leno and Letterman.
Alden.
Oh my god, I put Katie Couric and Diane Sawyer because I'm an idiot.
Audience says Regis and Kathy Lee.
That's good, yeah.
Letterman and Leno, and Vanna White and other guy.
And the other guy.
Yeah.
I do like when the questions allow people to get creative and funny with the answers, even when they're not right. But this is, in fact, Pat Sajak and Alex Trebek.
Oh,
that makes sense.
Can I get half a point? I'm just kidding.
Yours gets a point for the best fucking laugh in a while. That was awesome.
You know, that should be something we add to this.
Yeah,
Is
bonus
if
point.
you get the answer that makes everybody die laughing,
Yeah.
then you get like half the points.
I'm
actually-
into that because
that's
that's
actually pretty good.
hilarious.
I'm a huge fan of that.
Well, yeah. So like Mark Aram and Fred Blankenship. So Fred Blankenship is a black guy, and Mark Aram is a white Jewish dude, and they both do like traffic and weather and local news, and they'll bounce segments back and forth to each other, and they'll quote rap songs. They'll quote like '90s gangster rap back at each other.
That's pretty funny.
That's
It's hilarious.
I love that.
Yeah.
All right, this is a number question, so whoever gets closest will get the points here. In what year did this advertisement appear in the Philadelphia Inquirer and several other newspapers? And for our audio listeners, it is the classic ad where Taco Bell announced that they were buying the Liberty Bell and renaming it the Taco Liberty Bell.
Yo quiero liberty.
Bring it back is that the Chihuahua that used to say that, dude? Oh my god, my childhood, man.
Yeah.
Taco Bell.
Yeah.
3, 2, 1.
Steven,
Oh god.
2002.
Jessica,
I put 1990.
That's my birth year, yeah.
I put 2001.
Alden,
I'm in there in the middle somewhere, 1993.
We got 04 and 07 from the audience.
I think we're early. Oh,
Alden
96.
gets it.
Oh,
It is
Alden gets it.
1996.
All right.
Which means that at the end of round 2, we've got Steven with 9, Jake in the audience with 8, and Alden with 6.
I'll take 6.
You're so close.
Still anybody's game.
You can do it.
It is still anybody's game,
Yeah.
It's not Steven's game.
mathematically.
It's not mine either.
Jessica, technically speaking, you can still win.
If we had already had the comedy rule in place, you might be in the lead because that was
Round 3, entering the chat.
I don't know which one's funnier. Jerry Springer on Oprah or Oprah on Jerry Springer even. I'm sorry, I'm not over this.
Oh,
Go
man.
ahead, I'm sorry.
Question 1. The chat room tradition of pressing F to pay respects originated with what 2014 Call of Duty title? And this is a screenshot of the quick time action in question, which I actually had this game, but because I had it on the Xbox instead of the PC, it instead showed up as press X to pay respects.
Oh, hilarious.
2014.
This is also the one that stars Kevin Spacey pretty much as himself.
Ah.
All right, I think I got it. 3, 2, 1.
Steven?
I mean, that's pretty late. That's right about the time I had a kid and had to quit gaming. But I'm going to go with Modern Warfare 3. Where is it? Modern
You
Warfare
are
3.
the absolute worst at showing your dadgum page.
You really?
You have not gotten any better.
I know.
Every week, it's like a blind guy trying to find it. It's ridiculous.
Yeah, yeah.
Jessica?
I have no idea.
Jake?
I said Black Ops.
That's what I think.
Alden.
I think that's what I should have said. I'm in Steven's boat though in the Modern Warfare 3, but I think
Gang.
Black Ops is it.
Black Ops also is what it says.
This is Advanced Warfare.
Oh, that
Man,
one sucked. Ew.
I don't
Last
even
time-
remember Advanced Warfare.
That's the one that had FPS Russia in the commercial, isn't it?
I
Is
don't
it?
remember, but that game sucks. Oh, we lost Jessica. We started talking about that game was so bad she left, you know.
Question 2. The Signal Foundation, responsible for developing the Signal app, which was also the inspiration for this category, was co-founded by Brian Acton, who also co-founded what other messaging app that was acquired by Facebook?
Which also got politicians in trouble.
Hey. The more we can get them in trouble, the happier I'll be.
Hey.
All right, time's up.
Steven,
What's that?
Jessica,
Oh, dang it. I put MySpace. I thought we were talking about Anthony Weiner.
What's that?
Nice.
Anthony.
Alden,
Carlos Danger is into the chat.
What's that? Yeah.
He gets the funny points again. That's so-
Anthony Weiner always gets a chuckle out of me.
question 3.
How can you be a politician and be named Anthony Weiner? That's insane.
And then show your wiener.
It's unbelievable.
And then have an
It's
alias,
ridiculous.
Carlos Danger.
Question 3. The interface pictured here is from what chat service launched in 2004 for the Nintendo DS?
Oh, what?
This is the pinnacle of Gen Z questions right here, because every time me and my cousins got together for Christmas, we would just all go in different rooms and talk to each other on this service.
Really?
Nintendo DS's.
Wow.
Okay, if you say so. 5, 4, 3, 2, 1.
Steven,
Hold on, I'm still writing, but it's Nintendo chat.
That's great.
Jessica,
I don't know.
I don't either, man.
I don't either.
Jake,
I said aim.
Yeah.
This is some deep cuts, man. I put WeChat. I have no idea.
Audience says Street Pass.
Is that it?
Yeah, this question was probably too hard, but I couldn't help myself from asking about this classic piece of my childhood.
That's
This
fair.
is Picto Chat.
Oh,
I've never
my
heard
God.
of that at all, man.
Yeah.
Oh my god.
Picto chat. All right.
Picto.
This is the make everyone else feel old section.
Question 4. I asked ChatGPT for a quote medium difficulty trivia question,
Okay.
and it said, "What is the only metal that is liquid at room temperature besides mercury?"
Oh,
I will only point out that the melting point of the metal in question is really about 86 degrees Fahrenheit, not exactly room temperature. in
yeah.
my-
Oh my
Oh
god.
my god.
I actually confronted ChatGPT about this once it told me the answer.
It's
And
only
it said
Florida
that
room
It,
temperature.
it said that in hotter climates, that 86 degrees would be on the upper end of room temperature.
Good lord.
Yeah, Florida only.
I don't know.
I'm so upset that I can't think of this. I'm gonna be so mad when I hear the name.
Oh no.
All right, time's up.
Steven,
Okay, well, due to the time constraint, the only answer that I have right now is T1000.
Oh man, that's great.
Jessica,
Cobalt. I don't know.
Jake,
Cobalt. I said your butt.
Oh my god, I can't think of it. I'm
You
gonna.
guys, my husband bought this fancy toilet, and he just got quiet. We're on the phone today. It like has like the buttons on the side. I guess it has like a bidet on it.
Yeah.
So why are you so quiet? This is like right before I got on the podcast. He's like, I just had my butt washed with this new toilet. Crazy.
Oh yeah.
What'd you say, Alden?
The bidet, the toilet.
Oh,
not
no.
the
What was your guess?
I can't think of it.
Zach says steel beams.
Yeah, ask NIST and they'll tell you. Gallium, it is fucking gallium. God damn
And
it.
the audience wins it on the last question of
No,
It is fucking gallium. I couldn't think of it. As soon as I saw it, I knew it wasn't even the answer. It was just an audience answer, and I knew it was gallium.
Stupid audience. What was this final score?
It is.
Alden was 9, Jake was 11, Steven was 12, and the audience was 14.
So would I have won if I had said gallium, or would the audience have still won?
The audience still would have won.
Oh, well, then I don't care.
Yeah, you'd have gotten second.
I don't care. Good job, audience, then. I don't care.
What? You won, some quack. Shut up. Oh my god.
That picture is worse every time I see it.
Okay, let's get everybody back where they're supposed to be.
It's like a metal that's like the consistency of like chocolate, kind of like.
Oh, interesting.
And it's non-toxic.
Also, that picture is phenomenal, and we're never going to change it.
The audience,
the more demented the audience,
oh my god,
porcupine, the better.
I guess.
All right. Well, we've come to the next segment of our show, which is Drunkard of the Week. So here you go.
I am not fucking drunk.
Well, 19th or blue.
Every pretty girl deserves to go to a ball.
This is everything about it's a clam. I love it.
I gotta be honest with you, I feel like I'm a little bit too drunk to stand up.
On Wiedersehen, asshole.
I'm drunk right now.
Gets me.
Gallium.
Oh, gallium is apparently the drunkard. Wait, no. I'll be back to her. There we go. Okay,
we're all professionals here.
This is courtesy of Mr. Stephen Hilton in the Discord chat this week. There were 3 good ones. This is the one that I picked.
Cost that is involved.
Oh,
there's 1,000 of you. I said, close them doors.
This is a preacher.
Ushers, close the doors. Close the doors. Close the doors. We all gonna leave together. Y'all ain't going no place but to the restaurant. There's 1,000 of you tonight, and those that are watching, it's 1,000 that's watching online. This is a small seed. If I get 1,000 online to give this, if I get 1,000 in the sanctuary to give this, that's $40,000 tonight. I'm challenging each of you all down here to give a $20 seed.
there you go.
I just think $20 is a lot of money. $20, believe it or not, when my late wife Melinda P. Sapp was alive, was a good date.
Tries to make it all folksy.
I could take her to the movies, buy a box of popcorn, get 1 soda, 2 straws. I wasn't cheap. That's swag. I was looking in her eyes. She's looking in mine. Can't do that no more. Now, everyone up here, we've all sold and seeded, but I need everyone standing up here with us, with me, to plant a seed of $100. Because again, it costs to sit up here.
Look at all the preachers.
Not
Like,
as
whoa,
think
hold
as
up.
you drunk I am.
Our drunkard of the week is Mr. Marvin Sapp. He is a reverend. He's a gospel singer. And he basically locked his congregation in the auditorium in order to extort money from them during a sermon.
Hey, just imagine if the federal government had to raise money like this. Like, taxes would go away overnight. Like,
oh my goodness.
Man.
That was, yeah. You know, it's crazy is like, I remember this is a few years ago. I think there were people who were trying to like rob the Potter's house. So during TD Jakes church in Dallas, so they had to like lock the doors like during offering because people were trying to like steal the baskets and like run. So that was the first thing I thought about. But then I saw this guy started singing. Marvin Sapp actually has a song called Never Would Have Made It. And somebody made a meme. They're like, never would have paid it. And I'm like, her right now. The memes are better than what he did on there because roasting him.
Oh yeah, God, that's great.
Well, that's like when I forget the name of the hurricane, but the one that really just rocked Houston.
Oh, Harvey, where
Harvey
Joel
came to-
Osteen's church didn't let people sleep in the auditorium because they didn't want the church to be messed up.
Osteen's church. Yeah.
Yeah. Oh yeah.
That guy. Goodness. Zane, how many times you've been locked in your church and them demand money from you?
Thankfully none.
Okay, good.
So far.
Making sure.
When we had a hurricane go over us when we were in Daytona, I stayed the night at my bar that I worked at, and we just drank beer all night and just watched the hurricane blow through. So it was fun.
Nice.
Yeah.
So yeah, no, I just thought that was absolutely ridiculous. For the church I grew up going to, the like offering boxes are in the like entryway. So like you don't even give when you're in the auditorium. You can give if you want to on the way out. You can give anonymously. Like
it's like a free museum where like you can if you want, kind of thing.
Yeah, you should not be like. It is not a pastor's job to demand
to
money
lock the doors. Yeah,
like, that is some messed up stuff.
Yeah.
Like that's insane.
It costs money to be up here, man.
That line. Oh my god!
Look at this! Look at this watch I got on, dude. These shoes I'm wearing. This costs money, bro. I need money.
if anything, all those people who are up there are already donating their time. Like they should not be expected to pay more because they're already donating their time to that. It's just the whole thing.
This reminds me of like the old school, like the literal, like pay your way to heaven kind of things that they were doing back in the day.
Oh, indulgences.
Yes, yeah, thank you. Not tithing, but indulgences. And literally, the term raking in the cash came from like they would open the doors in the morning and they would literally pull the money on the stoop like into the church with a rake because it was so much, and that's where the term came from.
I mean that was one of the big reasons for the Reformation, was because the Catholic Church was like promising that if you paid them more to construct their new cathedral, then it would reduce your time in purgatory. And Martin Luther was like, stop.
And if you said the earth was round, you got put in prison or killed. Yeah.
As you should.
Fun times. It's fun times.
Well, and then John Calvin came around and was like, you can give me all your money and you're still going to hell. How about that?
You dirty bastard. You're going to hell no matter what.
Oh, man.
Isn't it one time they texted me this weekend? I guess they're moving out of one of their locations. And they're actually asking the people from the church to volunteer to come in and help them move out. And I'm like,
what? Come on, y'all. Get it together.
Yeah.
All right. We'll move on to our final topic of the evening, which is the murder of Aslan. Not that.
He's dead?
All right. Meryl Streep has been offered the role of Aslan.
Oh, Aslan the lion.
Narnia.
It's so nice that we're seeing more representation of people that are trans species.
All right, y'all. So here's the deal.
Is
Chronicles of Narnia growing up was my favorite series. C.S. Lewis wrote it about 100 years ago. Little less.
Million.
Yeah, about 100 years ago. And the whole series is phenomenal. It's basically Christianity. Aslan is supposed to be the Jesus character. Okay. And they gave this movie to Greta Gerwig, who is a good director, directed the Barbie movie, directed Little Women, directed, I don't know, a few other things recently. And she's Lady Bird, very good director. And one of the biggest roles that she decided to give is going to Meryl Streep, which I have a huge problem with. First of all, just based on the fact that she's not sticking. It's clear she's not going to stick to the script. Like she's not going to stick to the accuracy of the book. She's not actually trying to portray the book as it was, which in and of itself drives me.
How do you do that when you're a CGI character? Don't you have like a set line to? I don't understand how this works, I guess, in film, but like,
what do you mean?
How much liberty can you take when you're a CGI character?
I mean, you can take all the liberty you want.
Really?
Yeah. Well,
yeah.
Because it's a female, the Southern Baptist Convention is automatically against this. I can tell you that.
I'm with the Southern Baptist Convention in that.
I mean, was Morgan Freeman not available? Honestly, like he's the perfect Aslan. Like,
Oh my gosh, he would have been such a good Aslan.
I don't know anyone that would argue against that, actually.
Right?
Yeah. What, Jessica? Did you ever read Narnia books at all?
Yeah, I read them when I was younger.
Yeah.
That's why I would say I totally agree with you that I think Morgan Freeman would be. His voice is just, especially since James Earl Jones isn't here anymore. You know,
my God.
Voice that just like
the voice of like a generation. Yeah.
Or and as much as I hate the guy's politics, Obama is a great voice for Aslan.
Oh,
I'm not gonna say the voice isn't gonna fit. Yeah.
No, he was offered a role in.
I've seen some of his like nature documentaries on Netflix.
Yeah, did you see the one about the oceans?
They're fantastic.
Whoa.
I've seen it.
My husband was like, he came in and he's like, bro, what are you? And I'm like, shh. Like I'm looking at and I think one time I had like 2 or 3 glasses of wine because it was a long day. And for some reason I told him,
you gotta explain to us, yeah.
We'll travel here. And my husband was like, you know, this is AI, right? And I didn't know. I thought it was.
Have you guys seen Snoop Dogg do the like?
I didn't know it was AI at first.
Have you seen when Snoop does the nature thing and he like watches and narrates like a nature show?
Yeah,
it's so
that one like some like weasel or something's trying to get away from the snakes and he's like, oh shit, run, guy!
The honey badger or something, or the
yeah.
Dude, those kill me. Anyway, can you imagine if Snoop Dogg was Aslan? Like
James Earl Jones licensed his voice to be used by AI.
Did he really?
Okay.
What a generous donation to humanity.
Wow. Yeah, I mean, he's got that.
That's like putting your body up for science. Like this is like the equivalent to that with your voice. Like that's incredible. Yeah, seriously, one of the greatest voices of all time.
Yeah.
I don't know. Does anybody else have any? So we don't have to talk too long about this, but I just had just my reaction. I got heated and I yelled over the phone to Nikki and she didn't care. She said,
"I'm picturing it in my mind. Like it's not working for me without a lot of augmentation." But
when the Marvel universe was ramping up to the end of whatever chapter or phase or whatever it was to the end game, and then you had the Captain Marvel introduction. The Carol Danvers, and then Brie Larson. Like, I was like, okay, cool, whatever. But then every time she got a microphone in front of her face, she started talking about like intersectional feminism and blah blah blah. And I'm like,
what are we doing? Like a movie?
Like you're a comic book character, lady. Like, what are we doing here?
Yeah.
Snow White syndrome.
So like
that poor girl. Yeah.
So I feel like this is like a similar level of like activism coming from the director actually for casting this, because like first of all, you deliberately did it as a female. Like, let's just be honest here.
Yeah.
You have a lion, which I mean, like we've all seen the books. We've all seen, the original sketches from the original books. It's obviously a male lion.
Right. There's a name.
So, like, you deliberately casted this as a female first and foremost, but like, it's not, I mean, Ellen DeGeneres retired, so obviously she wasn't available. So, who's next that we could pick?
Yeah.
Maybe Whoopi Goldberg passed up on it. And so like, oh, hey, Meryl Streep will do it. That'll piss people off.
Well, it's like so many directors these days, and I think the trend is slowing a little bit now that we've kind of gotten past peak woke. But there are so many directors that are more interested in subverting a story than actually telling the story. It's very cynical, I think, and deprives people of actually just being able to sit down and watch a movie and enjoy it. You're not allowed to just enjoy things anymore. Everything's got to be a deconstruction.
The irony here. Oh, sorry. Go ahead.
It really has the agenda. Yeah.
The irony is that I think the message works better. Like if you actually really did want to convey a message, I think the message in your art works better if it feels authentic and if it doesn't feel forced, and if you don't like hyper fixate on the message, and if you actually make a good story and like have emotional connection to the characters. And one of my things with a lot of modern movies now is I have such a disconnect from it because I'm like, they're trying to like hammer this one point in, but like I have no connection to the reasons why a character would do that. And if you really wanted to like change a culture and make an impact, and I'm not advocating for whatever these different, directors or creatives are trying to specifically do, but I'm saying if you wanted to, the way they're going about it, I think is less effective than if you were to actually just make authentic art where you empathically sort of like connect with the character's motives and decisions. And that would actually, if you wanted to, do a better job of it, because I just get annoyed when I feel like I'm just being sold more propaganda than I am given story. I don't know, maybe just me.
In general, if you're going to take the work of somebody else, it is understood that you're going to do it justice, and you're not going to just change things willy-nilly.
Unless your name is Stanley Kubrick, and then you can do whatever you want. I don't care.
What did he base his movies off of?
Well, The Shining was a book.
Oh, yeah.
There's a whole famous feud with him and the author with Stephen King, and Stephen King hated it. And there's the color of the Volkswagen Beetle that goes up the mountain, the Sidewinder in the beginning intro. It's yellow. In the book, it was red. And in a movie later, when what's his name, Scatman Crothers was driving up the snowy road to go up back to the mountain again or whatever, there's a red beetle overturned in a wreck with a semi, and it was like a metaphor for like your version of it. I made it yellow, and then the red beetle later I fucking flipped over like this is my project now kind of thing, and there was a whole thing anyway.
Who's really good at telling stories of people through their own lens that like is super creative, it's not divisive? Shonda Rhimes.
Okay, I know Shonda. Yeah.
I just finished watching the murder mystery about who's in the White House, and so she does a lot of roles where she has like a very strong Black woman character.
Yeah,
but they're so like smart. They're so, like they defy like a lot of norms that you see, and they like solve problems. And like she tells her stories through like her lens, but it's still great TV for everyone to watch. And no one feels like, even like Bridgerton, when she was talking about Queen Charlotte, it was just very, very interesting. And just looking at how she directs and produces and things like that, she tells her own story through her own lens, but it's also inclusive of everyone.
Yeah, she did How to Get Away with Murder and a few others that
Scandal.
Yeah, Scandal. There you go. Yeah, I actually met her down in Austin.
Oh wow,
that's
she's
cool.
a very nice lady. Yeah, very talented. Yeah, I mean she gets big contracts from big TV networks. Like she's the real deal. Yeah, so that just infuriated me for a minute, just because it seemed so arbitrary. It just seemed so in your face. It didn't seem like there's no actual creative function for it. It's
this is not like The Little Mermaid is black. I don't care about that. Like a mermaid is a fictional figure. I don't care if it's orange. Like
the Trump
this is an actual, like, you're making a statement with this. You're taking a deliberate male character and not just making it a female. You're making it Meryl Streep.
Yeah,
it's trying to, I think, make a statement and ruffle feathers and get people talking, and it's almost like the publicity is bad publicity kind of thing with it. And yeah, exactly.
We fell into the dadgum trap. My bad.
Yeah.
Jake, how could you?
Dadgum it. All right, y'all. We're gonna wrap up here in just a minute, but Jessica, before we go, first of all, where did the name Zara Medical come from? Zara.
So when I picked the name Zara, it actually means beautiful in Arabic, and I was trying to find a name. I was like, I wanted something that encompassed a great experience for patients. I wanted something that would be memorable. I wanted something that would defy the norms of healthcare. And so when I found that name, I was like, you know what? I think I'm going to do that. And so I ended up picking the name Zara because I wanted the healthcare experience to be beautiful for all patients, no matter where they were in their health journey, whether they had to come to the doctor because they were, just couldn't wait anymore, or because they didn't, want to do things differently. There's my daddy.
There we go.
Here's my daddy. And then I have a couple of other doctors starting with me in like May and June. But we're just trying to provide great healthcare, and I'm licensed in all of those states.
Wow.
That is a lot of
Amazing.
state.
That's
So,
so much.
what is that continuing ed like? Is that you get reciprocity between a lot of those?
Yeah, so they actually have the Interstate Medical Licensure Compact. So as long as you live in a state that's actually a part of the compact, you can apply and you can get licensed in like up to 35 states.
Steven, why do you know that? Does this apply to the surveying or?
Yeah, well, yeah, I'm a professional land surveyor here in Georgia. Yeah. So
I know about this through Haley, but I didn't know that you would know about this.
Well, yeah. So like we have continuing ed requirements because we're
okay.
Yeah. For the state.
So any licensure by state, then I guess. Okay.
Yeah, is a little bit different though. So like some states are like, oh, you have to have 50 hours, some you have to have 25, but
or sometimes you have specific clauses where you have to focus on, like for Haley, she'll be like, you have to have like a multi-hour seminar on like suicide prevention or whatever, or like, and one state will have it and one state won't, and something. And
right. Yeah, they don't have as many requirements on that. Most of them are like CME. Some of them do have where you have to get certain training. So like for instance, New York has a really big course where you have to take it on child abuse. And recognizing the signs and symptoms of that. New Jersey actually has one in cultural competency since they have such a diverse, traditional patient demographic. Some other states like Texas has a big thing on ethics with physicians. And so every state's a little bit different with what they require. But I think there should be a way at some point to be able to like merge all of this stuff together so that like, there should be like one single like license, but I don't know if the bureaucracy
that would be interesting.
State would be something that people want to do because it's not as much money.
Yeah. I don't know if I've seen so many like states listed as like licensed in so many states before. That is impressive. Just in general, I'm impressed. I think Haley's got like 3 or something.
Actually, a lot of auto workers. I take care of a lot of federal workers because I'm licensed in like Maryland and Virginia. It's been a really rough time for some of them. Worried about their jobs, and then other patients who are in Michigan, with like the factories and things like that. So I try to be a doctor for everyone, whether I have some, patients of mine who are celebrities and I have some who are stay-at-home moms, and I take care of everybody and treat them the same. And when I get on, I'm like, hey, how you doing? I'm Dr. Evers, especially, and I try to start off the visit where they're like, okay, at least this lady's like human. She's not acting like she's mad about having to be here.
That helps.
Well, I'm a huge fan of what you're doing.
Yeah.
Can you shout out your website again so that people
can... It's www.zaramedical.com.
There we go. And it's down in it's in the episode description as well for anybody who wants to click on that and go check out her site. Also, if you want to go to peacefulsea.network, you can check out our website. You can join the Dollar Media Club. You can see our documentaries, our movies, everything that's on there. You can watch other shows, subscriber-only podcasts. You can get sick merch like our glass right here, Cascade Effect sweatshirt. You can get all sorts of stuff. So head on over there. And we're going to wrap up on some funny videos and some funny things that I've found throughout the week. So first one is this awesome toddler.
Straight into the mouth. That's awesome. This is like how I am at like a restaurant where they have the cheese grater and they're like, say when. And I'm like, I'm not going to say when.
Grate the cheese right into your mouth.
That's awesome.
All right. Video number 2.
Sleep at night. Sleep is for elderly people. My parents in their 30s. When I'm sleeping, I'm not causing chaos. Right? When I'm awake, I can continually cause chaos throughout the day. Consistent for comfort. Want to know what I had for breakfast today? I ate 1 grape. That's all I'll need. Don't eat food. Food is a waste of time. When I'm chewing, when I'm swallowing, not causing chaos, okay? Licking a grape gives me enough energy to torment my parents for an entire morning. I don't swallow water, okay? Another waste of time. Time equals chaos. I hold water in my mouth for a little bit, and then I spit it on my shirt. I don't need to drink it to become hydrated. I took a 10-minute nap. in the car today. That's all I need. My parents wanted me to nap longer. Guess what? At highway speeds, it's like napping. It's like 60 times the amount of sleep. It's like napping in dog years. Today, my mom tried to put my pants on the right way. And I was like, excuse me, miss. I don't subscribe to the traditional pants system. I'm a pockets on the front type of guy. Break the mold. Mom, you're old. I'm the reason your coffee's cold. Don't sleep.
Yeah.
Oh, that's perfect.
That was perfect.
Everything he said. My daughter.
Your daughter is like that?
My three-nager. Yes.
Mm-hmm. Three-nager?
Yeah.
Good. That's such
All
a good
she doesn't know. I'm like, hey, Jason, you want? No.
Three-nager.
Yeah.
I've never heard that.
And my oldest, we called him a 3-Rex because that was. I mean, he'd walk in a room and just like if anything was on a countertop, he'd slap it off. Like that was just.
He's like a cat.
I was gonna say he's like a human cat. Yeah.
Yeah.
All right, we got 2 more left. This one's very short.
I get it.
We've all been there.
Yeah. It's too fast. Good bacon.
I get it.
That's either one delicious looking bacon or one really stupid dog.
It's probably a really smart. Like I have a poodle. My poodle he will solve a Rubik's Cube if you need him to. Okay, but then he will also eat something that he knows is going to choke him.
Yep.
And throw it up immediately.
All right, final video of the night.
I feel like playing right now. Me? Yeah. It's not wrong. No. Just play it real quick. Just play it real quick. Me and Matt wrote a song. It's a really good song. It's a very deep, introspective song. Can you please play it? Yeah, tell me.
I'm afraid of where this is going.
Right now. All right. It's not wrong in the morning. It's not wrong in the night. It's not wrong in the afternoon, 'cause afternoon delight. It's not wrong to keep a secret. It's not wrong to tell a lie. It's not wrong to say I don't know when they ask you about last night. It's not wrong to put a finger in a place you've never tried. It's not wrong. It's not wrong to make some sweet, sweet love if the feeling feels so right. It's not wrong if you love her. It's not wrong if you don't. It's only wrong if it's your sister. It's only wrong if it's your
sister. Oh my gosh.
Wrong if it's your sister.
Roll Tide.
So good.
Fair.
All right, y'all. Well, Jessica, thank you so much for coming on the show and sticking around the whole time. You've been amazing.
This was so much fun. I haven't had this fun in a very long time. It was amazing.
Awesome.
Like, I know my babysitter was like cursing me out. I said, I'll be there soon. I'm having a great time. So I really, really enjoyed it. So much fun.
Well, we'd love to have you back sometime in the future.
Anytime.
when you've got like a development with your business or something new is happening. Like reach out to us and we'll have you back on.
When you have more rants about insurance or government or anything like that, we're here,
Can't wait. Can't wait.
All right, everybody. And Jessica, you can stick around after the credits and we can chat for a second if you want. Otherwise, taking up 2 hours of your time. So everybody else out there, thank y'all for tuning in to Liberty Libations number 119. We'll see you next week for episode 120. Peace.